the benefits and the risks. Some hospitals will have you do the full informed consent, or the doctor comes in to do that. Depends on your facility. The whole purpose of this is you're trying to educate your patient with as much information as possible, so that way they can make a informed decision on the procedure they're about to have. Okay? Refusal of the treatment. Sometimes the technologist may experience a patient's refusal of the treatment. It is the patient's legal right and one that must be respected. Never ignore a client's decision to refuse. Okay? Now, going back on the refuse. They may not be refusing because they don't want to have the procedure, they don't want to be done. They may be refusing is because they don't understand what's happening. So, when we talk about patient communication a few weeks from now, if they don't understand, change your verbiage. Don't restate what you just said. Because if I didn't understand you the first time with the words that you use, you think I'm going to understand you the second time? Rephrase it. Rephrase. Not repeat, but rephrase. Okay? Rephrase what you're going to do. Because again, it might be because they just don't understand. And this happens a lot. So what happens is, when I used to be a manager, I have the tech come in and say, you know what, patient refused. Okay, well, did you tell them about this, this, and that? Yeah, okay. All right, let me go see if I can go talk to them. Okay? And usually it's because when I talk to them, they get a better understanding, and they'll say, yeah, okay, yeah, let's go ahead and do this. All right? But communication is very important in trying to make the patient understand what they're going to have done. Now, what I've also done is, patient refused. Okay, well, did you do this, this, and that? Yeah, I did. Okay, did you do this? Yes, I did that. Okay, let's go ahead and reschedule them. Here's the problem with rescheduling, and you got to take this from the patient's standpoint. Because you were lazy to not get a full understanding of why the patient is refusing, okay, this patient is going to go home, not having the procedure done. Guess what's going to happen? The doctor's going to have them do it again. Okay? To prepare for these procedures, they're usually NPO the night before. So they're starving themselves for 12 hours. And then they have to take the all the diuretics and also the, what do you call that? The
antihistamines?
No, I'm so lost for words right now. The cleansing stuff.
Oh.
The bowel cleanser.
Laxatives?
What is it? Laxatives. Yeah, laxatives. So they're cleaning out their bowels, okay? Because we want their abdomen cleared out. So they're NPO, they're taking laxatives, taking other types of medications to prepare for the procedure, and they end up not doing it. Well, the doctor's going to say, we do need you to do this, so then they have to do the prep again, all over again. So you have to look at it from the patient's standpoint, is that, oh, they have to suffer through this again to have the procedure done that they didn't have done in the first place. What I do is I usually keep a logbook of the techs who were going to do that procedure, okay, because in my head I said they're going to be back. I will reassign that same tech to that patient, okay, because you were lazy to do it the first, because I have techs. There will be techs that will do anything to get out of certain work, okay? We have techs like that, unfortunately, so they will try to get out of certain work. So I put a list there. I said, all right, I know patients will be back in a couple of days, and they do, and I'll reassign them that patient. Okay. All right, so refusal of treatment. If the patient refused, undeniably they refuse over and over again, and you go ahead and continue to do the procedure, remember what I said, what was happening here?
Battery.
It's called battery, okay? All right. Here's an example of a consent form. Tells exactly what the patient's going to do. Again, it's an informed consent so that the patient can make an informed decision about the procedure. You have all what we're going to do. It has most of the benefits, but it's also going to list the risks. Okay? You may have some adverse effects, including nausea, vomiting, facial flushing, and a feeling of warmth throughout your body. There's a possibility that you might break out in a rash or a hive. There might be a possibility that you're going to go into shock and possibly die. Miss Jones, do you still want this procedure? Informed consent. Okay? They sign it, you sign it, the doctor signs it, and we date it. And we're good to go. Thank you.